Well, hello there, everybody. I'm here today to talk to you about our project called Caring for Carers of People with Dementia, a new way to support isolated carers. First up, I'd just like to acknowledge the project team. As always with this sort of project, there's a large team behind it. First, there's quite a few people from Global Community Resourcing involved, people from Central Queensland University, our consumer representative, Karen Nixon, RMIT University, Swinburne University. We have a consultant gerontechnologist from Denmark, and of course our senior project officer and our facilitator. This project was funded by Australian Government Department of Health, Dementia and Aged Care Services Fund. It's a research and innovation grant, a grant opportunity 1, support for existing and emerging challenges in dementia. So dementia in Australia, there's over 425,000 Australians living with dementia. And this statistic always throws me a little. There are 250 extra people living with dementia every day within Australia. Dementia is the second leading cause of death, and it's actually inching towards the leading cause of death in older people in Australia. By 2050, there will be over 215,000 people in Queensland with dementia, and that dementia prevalence will actually be greatest in Hinkler, Hervey Bay and Metro South. Dementia is personal. There's more than 200,000 Australians who provide informal care for a person with dementia. It's a surprise to some people to realise that 70% of people living with dementia actually live in the community. So most people with dementia are not in an aged care facility. Yes, they may end their life in an aged care facility, but the vast majority of their caring is done within the community. Those carers are mainly a spouse or an adult child. 2/3 of those carers are women, usually. 50% tend to be aged over 65. And that's a group of people with their own health issues. So our experience and what led us to this project, we did a couple of projects. One, we interviewed people in rural Australia who were carers of people with dementia about their experience 12 months after the person that they loved had died. We found that their knowledge about the availability and the utilisation of support for informal carers was actually very lacking. They found that it was difficult to leave their loved one to get out of the house, and we found that carers were socially and geographically isolated. At the same time, we were testing a home-based group video conference program for older people with chronic disease. And we actually found that social support can be provided by video conference groups for a group of people who were an average age of over 73 years. So what is the Caring for Carers project? Our mission is to connect carers with other carers. We want to increase their social connection, their quality of life, and the mental health of carers of people with dementia. And we're testing whether we can do this using a video conference platform. What is the Caring for Carers program? It's a group video conferencing information and chat experience. There's six chat sessions with an experienced facilitator, 6 people per group, and it's a mix of information and sharing of the carer's own information. We've gone for an approach where carers bring their own device, such as their laptop or their computer or their tablet or their smartphone, so that when we leave, they've still got their equipment with them. The program was co-designed with carers for carers. That was done. We got some carers together, a group of 6 people who worked with us to examine the carer role and inform our video conference peer support program. The process mapped their carer journeys, came up with some problem solutions for issues, noted carer skills and issues, and then came up finally with the discussion projects for the program. The session topics, I guess they're the usual suspects. The first session starts with getting to know you, which is an important part of any group process. And the next session, which is also mandatory, is navigating the health and social care systems. Now that's focused on not just because we realised that there was a gap there from our past research, but also this is what carers felt was a really important part of being a competent and confident carer. So other session topics like caring for themselves, being an advocate for the person they love, health literacy, which is about finding information which is, I guess, valid out there in the world, managing care, increasing their support networks, and how the relationship with the person who has dementia changes. How did we recruit isolated carers of people with dementia? Well, recruiting the carers to the program was an essential task. Our focus group, our target group, was isolated carers of people with dementia, focusing on Queensland, but generally accepting people from throughout Australia, and people had to have access to the internet. So how did we actually recruit those people? Because they're by definition a disconnected group of people. We had a very, I guess, complex marketing and promotion plan across the 3 levels, macro. So we cold called media and service providers, PHNs, councils, Veteran Affairs, Lifeline, the peak bodies such as Dementia Australia, Carers Australia, National Seniors, and National Rotary and Probus Facebooks. We went to a meso where we actually had level where we had site visits and 2 monthly updates by email. We focused on dementia advisors, service providers, alumni, senior citizen centres, geriatricians, etc. And micro, we did a snowballing where there's testimonials from participants. It was opportunistic, it was iterative, and individual word of mouth type approach. So we tried to have all bases covered. We also had 3 formal site visits where we went to Cairns, Wide Bay, and all around central Queensland. And you'll see there's a photo of me with my travelling RV. I went out across Queensland. I drove over 10,000 kilometres meeting people as far away as Longreach and Charleville, and as close in as my own hometown of Gladstone. It was a stunning experience, and I met many carers. And if I didn't have an understanding of what a big job that is after that process, I was quite, I guess, overwhelmed by the unmet need out there and by the work done by these carers. How many contacts did we make? Well, at the macro level, we contacted 80 national and state peak bodies. At the meso level, look, about 700 at least, and that's an estimate. There would be over 700. We're still collating that information. But micro, face-to-face direct, probably at least 200 people we talked to face-to-face. That was at the 22nd of March. We did 109 radio interviews. We had 20 newspaper articles, 1 TV interview. We had 645 views on our Facebook post at the highest level. Online news stories, we had 13. Our community smart assistive technology collaborative platform had 12 items about the project on it. We distributed 8,580 brochures and flyers and 2,441 posters. As I was distributing posters, I actually thought I'd given out about 500, but it appears I gave out about 2,000 out on my roadshow. So a lot of advertising out there. Here's an example from Carers Queensland Together magazine of the sort of article that was run for us by organisations. So we would send out I guess a template for what they could say, and they put this in their local newsletters, and this happened quite a few times that were in local newsletters. How could people contact us? So once we were out there, as I call it, shaking the bushes, how could people contact us? We tried to make it as easy as possible for people to contact us. We had a dedicated phone line, we had an email, a website. On that website, people could just go in and press a button and register their interest. We had a Facebook page where we had regular posts and also opportunistic posts for me as I was out there in the communities. And we also let people contact us by snail mail. So we had a post office box. So we tried to make it as easy as possible for people just to get back to us. So after all that effort, how many carers did we recruit? We were contacted by 160 potential carers. 87 of those consented to take part in the project. We currently have had 72 active participants, so there's about, I guess, 5 still to be active participants. For 13, we've still got consent pending, so they may be going into a group or not. 47% did not consent for various reasons, mostly because it was too much of a commitment at 6 sessions of 1 hour. And that's understandable given the job that being a carer is. And 13 were not eligible. Interestingly, some of those were formal carers of people with dementia who were looking for something to help them out in their job. It was, after all, a research project, so we had quite a strong evaluation plan. We wanted to examine whether the response of isolated rural carers, what the response of isolated rural carers for older people with dementia was to a video-based peer support and info program. We used an experimental randomised design with a wait list control. Our main outcome measures were social isolation as measured by the UCLA loneliness scale, the K10 mental distress, and their self-efficacy is measured by the generalised self-efficacy scale. We asked people to fill in 4 online surveys over 6 months, and we undertook 1 qualitative interview with people. So firstly, what was the acceptability and feasibility of our video conference social support program? Here's some quotes from some people. I have to say that overall there was a general positivity from people. There was some nice feedback about how we could improve, but people really found that being in a video conference was pretty much just the same as being in this room, the same room as other people, and people quite liked the fact that they were talking to people all over the country, and being able to speak to people who were quite far away in the same sort of situation was quite comforting. As one participant said, it was just good to be able to be open, open my heart and just tell my story and know that they'd understand as I understood their story. People found out about different organisations they weren't even aware of, and the benefit that people got was it made them feel less isolated. What were our carer characteristics for our sample? So at the time when we had 49 participants, we found that the mean age of carers was 61 years, which is pretty much what we might expect. 70% of those carers were women. 50% were spouses and 30% were daughters. 36% were retired, with only 13% still able to work. 65% had 1 or more health conditions of their own, and 60% had a healthcare card. So when we had a look at our preliminary baseline, again, when we only had 49 people at our main outcomes, our social isolation, we found that was slightly above in terms of they were more socially isolated than the general population. Their mental health, they were not quite likely to have a mental health disorder, but they were definitely in mental distress. And their self-efficacy was lower than the general population. So I guess what that tells us is that we did actually, even though we beat the bushes for a long time and managed to actually contact, get 87 people on board. Those people were the people we're after. So there were people who are socially isolated, the people who are in mental distress, and people who don't feel dreadfully self-efficacious. So when we had a look at social isolation, mental distress, and self-efficacy, there was no difference in our group for their there's no difference for those particular outcomes according to gender or their relationship with the person with dementia or their education. But cohabitation was actually, that's living with the person they cared for, was associated with higher mental distress, and significantly so, and lower feelings of lower self-efficacy, but it had no effect on their social isolation. So this is a very difficult to reach group. We know that it's feasible for people to bring their own devices. we know that video conferencing is easy from their report, and we know that we're actually contacting people who have demonstrated unmet need. So what are the benefits and outcomes so far that we've identified from the project? Well, overall, I'd say that the picture of the program is one which provides connection for those who are disconnected, support for those who are in need of support, provides carers with new ways to self-care, and carers get a lot of learning about new services, either out there in the ether or in their own community. We really see this program as another tool in the toolbox for providers of support and information for people with dementia and their families. At no stage did we say stop doing anything else you're doing. In fact, we like to hear about what people are doing, because that's a nice way for people in the room to find out about what resources might be available out there. So this isn't going to be a solution for everybody, but it's another tool that people can use to connect with sources of support and information. The co-design with carers of people with dementia for carers of people with dementia means that this content and format is acceptable and appropriate. The video conferencing software that we used is actually very readily accessible, and our bring your own device approach means that people can meet using their own computer, laptop, tablet or phone for continuing after our 6 sessions have finished. We have found that we've completely finished 10 groups, and 6 of those groups are continuing to meet. When we ask people if they'd like to continue to meet, in fact 75% would like to continue to meet. So I think in terms of have we achieved our objective with the development and implementation of this project, I think that that's a big yes, because people not only enjoyed the program, but they want to continue to meet with that group they've connected with. And I have to say that was a big vision of the project, that people would want to continue to meet. And finally, what have we learnt from the project? I think, like many researchers before us, we do realise very clearly now that recruiting carers of people with dementia is very difficult. Out there in the literature, the most efficient way to do it is to have a mass mail out. Unfortunately, we do not have a centralised database for people with dementia or their carers in Australia. There's a couple of projects happening at the moment where that may become a reality, and having a centralised database would improve the ease and efficiency of recruiting this very vulnerable but difficult to contact group of people. Another thing that came through clearly to us is that projects that engage carers of people with dementia really need strong support from peak bodies. So the Dementia Australia and Carers Australia organisations really need to help us to contact these people for this sort of project. And provider and community organisations are important contacts. So community organisations in particular, even if they don't have people as their clients, in places like I guess Buckalden, community organisations know their community at the local level, so they know who the people are who might be interested, even if they're not their clients. Another thing that is, I think, an important outcome, and that important learning, is that we had groups with quite a diverse group of carers. So we deliberately decided that we would have a mixed group where we had carers of all sorts, so from those who just their loved one had just been diagnosed to those whose loved one was being transitioning into aged care. And the strong message we got from people was that's actually really good to start with, and it added I guess a depth to the groups at this time. But people also said that then they'd like to go on and do another group with people who are more like them. So we in particular identify that carers of people with early onset dementia have a need to talk to other people who care for those with early onset dementia, because there's some special, it's a special case, because often that is your spouse, and if your spouse is 50 with early onset dementia, that really does have a massive impact on your life and the changes. You may or still have younger children. Carers whose loved ones are transitioning into aged care, there's a lot of support that people need at that stage, because it's a very, very difficult decision and a difficult process. While it isn't undertaken lightly, so often people do keep people in their home longer than they should, and that's not good for the carer. It's not good for the person with dementia. So there's some extra support needed at that time. And carers whose loved one has died, they tend to drop off the grid, and they still have some quite significant needs up until the time when they decide they're ready to move on, and that can take 12 months or longer. So that's also an area of special need. So that's pretty much all I have to say today, and I'm really happy to field any questions.
Thank you, Professor Lynne Parkinson, for your very interesting presentation today. I have a couple of questions from the audience. Thomas has said, I am a carer for my mother in rural Western Australia. Congratulations on this fantastic project. I can see the opportunity for my family. Are there any plans to mainstream this into the suite of services available?
Well, Thomas, that would be absolutely wonderful. We certainly are looking at that. There's nothing solid at the moment, but it's our real wish that this can be mainstreamed, because as I've said, it is just another tool in the toolbox. It's easy to do. If people have their own technology, then it's fairly cost neutral. If you've got people who are working as formal carers anyway, if we could train people up to do this, it's not a difficult idea. It's really a facilitator. So you don't, our facilitators, one was a dementia, was specialising in dementia, but our other facilitator was a health promotion expert. So they're just good facilitators. I think for that in-depth knowledge about dementia, we'd always send you to someone like Dementia Australia to find out about that. What we're doing is connecting people. So doing that actual process, it's not taxing. I mean, someone could be trained up fairly easily, so it would be wonderful. So yes, we would very much like to have that happen.
Thank you, Lynne. Sally, who is an isolated carer, has asked, I would like to participate in the project, but I have very little digital skills. How can I start or participate?
I guess, Sally, the first thing you need to do is have a look at your local library or your local University of the Third Age and see whether you can increase those digital skills. One thing I would really like to see is if we did continue this project, I'd like to see before people start that they are referred to some of these organisations who you will be amazed. As I said, I've been out there. So there's a lot of opportunities out there for people to become more digitally literate. And in fact, there's places out in Longreach. It's a long way from anywhere, but there are resources where you can actually take part in a project like this without even having your own computer or internet access. So there's community resources which can provide that connection. So I'd first go and talk to my library or my local Blue Care or my local aged care organisation, because they often run those digital inclusion type projects.
Thanks, Lynne. And one last question from Bill. He's picked up the comment about a central database for people living with dementia that would be interested in participating in research projects and how that would help recruitment. He wonders if there is a central database for resources available for people either starting their journey or are through their journey and need that extra help.
Well, there is the Carers Gateway, which is a government website, and I'd probably say go there first. Then the two big organisations otherwise would be Carers Australia, who have a lot of resources, and Dementia Australia, who has a heck of a lot of resources, and they are out there. We have not said at any stage that there's not a lot of resources out there. But when we went into the community, we found people didn't know they were there. So a part of what we've been doing is making sure people know that those resources are out there. There's a world of resources for people who are caring. You just have to go out there and have a look. And those trusted organisations like Carers Australia, Dementia Australia, and that Carers Gateway through the government are the places to start any search for that sort of information.
Thanks, Lynne, and thank you for your presentation today. If people had further questions, what's the best contact for them to email?
Look, if they want to talk to me, l.parkinson@cqu.edu.au. I'm happy to field any questions people have.
Fantastic. Thank you for your time today.
Thank you.